As citizens, we are social activists. We have the opportunity to exercise our ability and right to respond to the call of our times and engage our collective intelligence around the questions we most care about in order to shape our future. Right now, 3/4 of this nation's citizens are calling out for affordable, quality healthcare for all that is national, strong, and available from day one. Every change in society begins with men and women being truly seen and heard. These concerned doctors have given witness to people with hardships resulting from the current healthcare system. As you listen, multiply each story by 46 million.
I'm a family physician. I support a public health insurance plan because I never want to see another Catherine. She came to my community health center after being uninsured for 4 years. After a simple pap smear, I diagnosed her with cervical cancer. If we have a public health insurance option, I know that primary and preventive care will be covered, and that Catherine could have gotten out of my office with a simple office procedure rather than getting cancer and losing her uterus. I know we can do better.
I am a concerned physician who practices in a public clinic as well as in a HMO. I am proud to say that most physician organizations in this country now support the healthcare reform bill that includes a public health insurance option. We physicians say enough. We can no longer take that patients of ours do not have health insurance. Everyone should have basic health care.
I've worked many years at community health centers and now I'm in private practice. In both community health centers and in my current practice, I've seen many patients not get needed services and care because of lack of insurance or because of having inadequate insurance to cover the costs of needed procedures and care. It's time that we took a stand as physicians, as citizens, and band together and advocate for a public health insurance option. It's the only way that we can ensure that the money spent on healthcare services actually it goes to the healthcare services for patients.
I'm a family physician and I support the public healthcare option because of her and the millions of children across the United States exactly like her.
The reason I support the public insurance option are my patients. Insured or uninsured, they suffer excess heart attacks, asthma attacks, and cancer because they have no access to preventative care. The current system leaves millions without coverage and hasn't controlled costs. My patients don't want more of the same in a different package.
Having practiced medicine for 35 years, our current system rewards more procedures and more tests. And yet there is no evidence to say that this promotes health. The healthcare reform will focus on prevention and the use of proven methods to improve health.
Healthcare is rationed now. It depends on whether you work part-time, full-time, in a big company or a small company. It's not based on clinical evidence. A public plan that guarantees you health coverage no matter where you work will promote wellness and prevention and help us all live healthier lives.
I practiced medicine for the past several years as a nephrologist. End-stage renal failure treatment was expensive and unaffordable for many. With Medicare, the expense was effectively brought down and became affordable to all Americans. This healthcare reform can do the same.
Every day, I see patients enrolled in private health insurance plans who cannot get the care that they need. Private insurers routinely deny payment for needed preventive services and for chronic disease management. And all of this is done in the interest of increasing profits for shareholders and CEOs, not in the interest of improving my patients' health care. President Obama has repeatedly asserted that giving patients the option to enroll in a public health insurance plan will introduce competition into the healthcare market and keep private insurers honest. And even better, patients who have private insurance that they really like and can continue to afford get to keep those plans.
My practice is devoting to caring for the homeless, the disabled, the working poor. Every day I see patients come in who have delayed care and then feel guilty or embarrassed about accepting care that they cannot pay for. We've lived so long with a healthcare system that does not acknowledge health as a fundamental human right that we've started to forget that it is. It's time now to show that we value our children, our parents, our families, and our communities by providing universal access to healthcare.
We are advocating for the basic human right of quality, affordable healthcare for all. This is not the time for partisan politics. This is the time for our elected representatives to do what is right for this country, to pull together and ensure the best possible healthcare plan for Americans. Together, we can create a legacy of hope for future generations.